Hi guys, welcome to Nursing Pharmacology. We will cover Chapter 1, the nursing process and drug therapy. All right, so first we will cover the nursing process. The nursing process is a way that nurses think about tasks at hand. And this is something that we all use every day in our lives. The nursing process consists of assessment, diagnosis, planning, implementation, and evaluation. We use the acronym ADPIE, A-D-P-I-E. First, we assess the patient. Here we collect data about the patient. What's going on? What is the problem? Next, we make a diagnosis. Now this is a nursing diagnosis. We can't diagnose somebody with hypertension or anemia, but we can say, what is the problem here? So an example would be somebody's having anemia. We can't make that diagnosis, but we can say shortness of breath, exercise intolerance. Here we're interpreting the data that we received during assessment and making our own diagnosis. The next step is planning. This is how we think we're going to manage the problem. Next is implementation, where we put the plan into action. And evaluation. How did it go? What happened with the implementation? So let's take our example of a patient with anemia. Anemia is a low red blood cell count. So we looked at our patient, maybe we looked at some blood work. They report shortness of breath, exercise intolerance. So we look at them, we make a diagnosis. This patient has shortness of breath and exercise intolerance. We plan. What do we need to do? How will we manage the problem? Maybe we'll think, okay, let me look at their blood count, and evaluate they are anemic. Let's call the physician. So that would be an example. So I want you to answer the following things. So identify where in the nursing process these are going to occur. So you have a patient with chest pain. Where in the process would you get an order for nitroglycerin? Where in the process would you give nitroglycerin? Where in the process would a patient tell you that they have 8 out of 10 chest pain? Where in the process would you think, maybe this patient's having angina? That is decreased blood flow to the heart that results in pain. And where in the process would you recheck the pain? All right, the next part, so why are we doing this? Why are we in this class? Why are we learning about pharmacology? We're not going to prescribe medication, so why does it matter? So it matters because we want to keep our patients safe. We want to keep our patients safe, and to do so, we need to understand all information about the patient and each medication prescribed. All right, next, we have 9 rights of medication administration. So this falls in with keeping our patients safe. So say, as in the last example, we're going to give nitroglycerin. So to give nitroglycerin, we need to follow all 9 rights of medication administration. So say we have an order for nitroglycerin. When we're obtaining that medication, we need to verify that it's the right drug. Is this the right medication to give in this situation? Am I pulling up the right drug? Next is the right dose. Am I giving the right dose that's on the order? And is this an appropriate dose for the patient? Next is the right time. Does the time make sense? Does it match what's on the medication administration record? Next is right route. We can't give an oral pill of nitroglycerin. If that's ordered, we're going to say that's wrong. Typically, we give sublingual. Is it the right form? If it's an oral drug, maybe it's capsule, tablet. Next is the right patient. Have I verified that this is the correct patient? Does this make sense for the patient? Next is the right reason. This would be chest pain for our patient. That would be correct. Are they having the right response? Nitroglycerin can drop somebody's blood pressure significantly. So if your patient has low blood pressure and no relief of chest pain, that's something you're going to think about. And then the patient has the right to refuse. All right, so we talked about getting the medication order, but we need to make sure that the medication order is correct. So what components of a medication order exist? Let's think, what is missing from our order? So the components include the dose, the route, the medication name, frequency or how often this is given, and the reason for PRN medication. So what's PRN? PRN means as needed. So if I am giving acetaminophen as needed, I would need to have the reason why. So acetaminophen as needed for headache. All right, so we have 5 medication orders here on the page. So I want to say what's missing from this order. So the first one is Risperdal, 2 milligrams, give 1 tablet by mouth. What are we missing here? We're missing the frequency. How often am I going to give Risperdal? Is it once a day, twice a day? Next is Mylanta liquid, 15 milliliters by mouth every hour as needed. What are we missing here? So we're missing the reason. Why am I giving Mylanta? 3, Aricept 1 tablet by mouth at bedtime. So here we have the drug, the route. We're missing the dose. So I know I'm giving 1 tablet, but what's the dosage in that tablet? 4, Tylenol 2 tablets by mouth every 4 hours as needed for shoulder pain. Here again, we're missing the dose. Tylenol comes in 325 milligrams as well as 500 milligrams. And the last one, Ativan, 0.5 milligrams, 1 tablet by mouth as needed. So when it says as needed, it's a PRN medication. You need to know what the reason is for that. All right, classroom response question. As a knowledgeable nurse, you know that the following are part of the 5 rights of medication. Should be 9, but except which one? It's right room. So say you're going to bed 5 to see Mrs. Miller, but due to staffing and the beds, Mrs. Miller is now in bed 6. So if you're depending on bed 5 to be correct, you're going to go in and you're going to give the drug to the wrong patient. All right, next. A 77-year-old man who has been diagnosed with an upper respiratory tract infection tells the nurse that he is allergic to penicillin. What is the most appropriate response by the nurse? A, many people are allergic to penicillin. B, this allergy is not a major concern because the drug is given so often. C, what type of reaction did you have when you took penicillin? D, drug allergies don't usually occur in older individuals due to build up resistance of allergic reactions. Okay, so you've got a 77-year-old guy. He's diagnosed with an upper respiratory tract infection. We're going to give him an antibiotic, and he says, hey, I'm allergic to penicillin. So A, The nurse is like, oh yeah, a lot of people are allergic to penicillin. Okay, is that addressing his response? No. B, this allergy is not a major concern because the drug is given so often. False. People can have penicillin allergies that results in anaphylaxis, which is swelling of the airway, as shock can result in death. C, what type of reaction did you have when you took penicillin? I like that one. And D, drug allergies don't usually occur in older adults due to build-up resistance of allergic reactions. Allergic reactions can actually get worse over time, so that would be concerning.